Dr. Beverly Reed.
And I'm Dr. Amber Klimczak.
And we are
Two Peaks in a Pod.
Well, hello, everybody. We are so excited because we have another in-person guest experience. And Dr. Yin, actually, I think you're in good company because was our last in-person guest experience your husband?
Yes.
Dr. Klimczak is the only other one we've had in person, right?
Yes.
Okay, so you are part of a very special small group of people.
Yes.
And we are so appreciative that Dr. Yin came in to see us today. And I wanted to just kind of share with everybody how we found Dr. Yin. So Dr. Yin is actually a specialist in acupuncture. And the reason my curiosity was piqued is I had a patient who I did IVF on. And unfortunately, her IVF cycle didn't go well. She didn't get pregnant. It didn't work. And then after that, she went to see Dr. Yin and she got acupuncture and she got pregnant without IVF or fertility treatment of any kind, which of course I was so happy for my patient, but I was extremely jealous because I said, how did Dr. Yin do that? And so ever since then, I've been just really wanting to learn as much as I can about acupuncture. And a lot of you may have seen a recent podcast that we talked about acupuncture, traditional acupuncture, and laser acupuncture. But as we kind of talked through it, we had some questions that we did have trouble answering because we ourselves were not experts in traditional acupuncture. And so we were so pleased and happy that Dr. Yin was willing to come and join us to answer some of our questions about traditional acupuncture. And so, Dr. Yin, can you just tell us a little bit about how you got started in this field and what kind of training you need to have to be an acupuncture specialist?
Yes, my name is Dr. Yan, and I've been working and practicing acupuncture for a long time. I started acupuncture with going to a medical school in China. And in China, we have to learn Western medicine and Eastern medicine both, and we practice both after we graduate. So I was practicing acupuncture and traditional acupuncture, Chinese medicine, and also the Western medicine in the hospital for 7 years. And then I came to United States because my husband came here for his PhD degree. So since then, I started teaching as a professor in Florida, in acupuncture school, acupuncture college.
Wow, you taught acupuncture.
Right.
Amazing. Okay,
I was
great.
teaching there for a few years, and then I moved to Texas, and also I was teaching in the acupuncture school, which was closed already for a couple of years, and I started my own practice in Texas, in Frisco, like 20 years. So that's basically I started my acupuncture career, and I really enjoy and like this natural healing treatment,
Yes.
Which has been helping people a lot to help in different kinds of conditions. And especially I see very good results in fertility support treatment. I wanted to say support treatment to help our doctors get good results to help people. Yeah.
Yes, amazing. Okay, so we're going to talk through a lot in the podcast, but for people that are listening that would like to come try acupuncture with you, how can they schedule an appointment with you? How can they find you? Does your practice have a website or?
Yes, we have website yinsclinic.com.
Okay.
And on the website, we have, you cannot schedule by yourself, but you can go into a kind of a link to give us your information so we can call you back. Leah will call you back as soon as we receive the information, your inquiry, and telling us your concern or conditions. We can give you a call back, or you can just call directly to our office, which is the direct number 972-668-2626. So it's easy to reach out to us.
Amazing.
Yeah.
Okay, great. Well, I just want to say for our listeners that I've been to Dr. Yen's clinic and I really enjoyed my experience. So I do highly recommend them. And her staff is lovely. They do call you back very quickly so they can get you in. And they're very flexible with scheduling, which I think really makes it nice on fertility patients. Because as we've talked about before, our patients have a lot of doctor's visits already. So it's nice that you're flexible with getting our patients in.
That's great because I know Dr. K is such a busy doctor. So the fact that they're able to accommodate that and help you get in and out, I think is just so helpful. Most of our patients are working women. We've got to have the time to be able to do things like this. So
yeah, we are trying the best to help accommodate our patients coming. And because we know it's not easy for everybody making that time to do the treatment each week. So trying the best.
I'm kind of curious. Certainly, I have a lot of patients that ask me about acupuncture, but I'm just curious on your side of things. When it comes to fertility patients, are most of the patients that you're seeing being referred by their doctor, or are they finding you before they've even seen a fertility doctor? So, for example, if somebody's just trying at home to get pregnant, let's say they've been trying for a year and a half, and they're kind of thinking, hey, should I schedule an appointment with a fertility doctor? Are you seeing those patients even before we're seeing them sometimes? Or what is your general sense of the proportion of patients that you're seeing for fertility purposes?
Yeah, we've been seeing both kinds of patients. Some people referred by their doctors after trying IVF or IUI. They need support treatment. They refer to us, and some people they heard acupuncture from their friends or heard from other information from other information area, and then they're trying for a while, like a couple years or a few months. They still wanted to keep the natural conceived way, so they come to us too. So we do use acupuncture to help people getting pregnant, like trying to help them getting natural conceive. And also at the same time, we do use acupuncture. We use different skills like we say the herbs or nutrition supplements or laser acupuncture, different things to support their IVF or IUI fertility treatments. Yeah, and based on what steps they are in, some people they have plenty of time, like a few months before their fertility treatment, but some people only have like a few weeks. So we do have different treatment plan, different frequency, different treatment plan based on what they are plan to help the most. Yeah, so that's the acupuncture we helping in different ways. So that means now acupuncture becomes more well known. So a lot more and more people and doctors know acupuncture, and some doctors just like they're more open minded to use this traditional way, the Eastern medicine, to help the Western medicine. Success.
They can go hand in hand.
Right.
So, Dr. Yen, do you feel like there are any patients that acupuncture is more or less effective for? Like, do you ever see a patient and you're just like, I really don't think acupuncture is going to work for you?
Okay. Yeah. So I want to say acupuncture is a natural healing treatment. It should be useful for most of the people, but any science or any kinds of treatment, I don't want to say it's 100% useful for everybody. So occasionally I want to say sometimes some patients don't respond to the treatment. Is sometimes can see, but most cases I want to say we've been using acupuncture, use this to help increase the success rate of fertility treatment a lot. Yeah, most cases doing very good.
Now, Dr. Yin, I've never had acupuncture done myself. And probably a big part of that is I am terrified of needles.
Okay.
Do you ever see patients like me who are terrified of needles?
Oh,
and how does that go? Do they get over it? Is it painful? Can you tell me kind of what would you tell a patient like me?
Yeah, we have patients scared of needles. They're terrified. They feel like, oh, this injection needles. I'm nervous or something. So, but these needles are different from injection needles. They are thin, like hair thin needles.
Okay.
So when we put the needles in, usually it's just the minimum feeling. You just feel a very light tap, but you don't feel real pain. Occasionally, you feel a little bit pain, so that some points themselves they have more qi clogging than other points, so you may feel a little bit more. But most of the needles you may feel is like pressure, heavy sensation. We call that qi sensation. It's a good sign. Yeah, it stimulates your bioflow energy moving in the meridians. That means it's working that way.
Okay.
Yeah.
And Dr. K, I know you have a needle phobia like I do. So, I mean, how did you overcome that? I mean, this is just very out of character for you to voluntarily let people put needles in your body.
It's true. Very true. So my first experience with acupuncture was a few years ago. And that, I think the very first time you do it, especially if you're a needle phobe, is when you're most nervous about it. And it certainly wasn't what I was expecting. It does not, and I've given myself injections too, right? It's nothing like she's saying, it's not like a shot injection type of needle, much smaller. But one thing that was different at Dr. Yan's clinic is one time, what's the name of the doctor that you work with? The other acupuncturist. She came in and I had, I guess, the larger caliber needle in me, and she took that out and put a smaller caliber needle. And I was like, wait a second, there's smaller needles? I didn't know that wasn't even an option. So can you tell us the difference between how come sometimes you can use smaller needles versus bigger needles on certain patients?
So the needles, we have different size, different gauges. So based on the different area, we put the needles in, such as the abdominal area or the back area or the legs or the scalp, the hands. In different area we use different size, different gauges needles. So that means so there's different layers of the muscle or tissues. You can feel the minimum. So trying to give you the minimum stimulate and not stimulate, minimum uncomfortable. Right. So the different size or gauges needles very helpful too.
So they give the small needles to the people they like,
apparently,
and the big ones to the people they don't like.
Small needles in the different area. Different area.
Okay, so, and I know this is a complex question, but just from the scientist point of view, what I really do try to understand is how could putting needles in the body help fertility? Can you kind of explain to me the mechanism of action by which acupuncture is thought to help fertility?
Yes. Acupuncture is a kind of treatment based on the meridian theory. So we have so many meridians which are bioflow energy moving in the channels in our body. So we have so many different kinds of meridians. We have 12 formal meridians. We have eight extra meridians. We have other meridians going across. We say from down to from the toes to the head, or from the head to the toes, and also it can cross the body into other meridians. So we have so many different meridians, and these different meridians they're connecting with our different internal organs and systems. So the main organs and systems related to fertility will be the three internal organs and systems and meridians related, which is kidney meridian, liver meridian, and also the spleen meridians. So we use acupuncture to target these different internal organs function that will help regulate the different things in the body. For example, the kidney is the one to dominate our reproductive system's function. It dominates our hormone levels, balance, pituitary's function, and also the ovaries function. It tries to keep the balance, the triangle balance between the hormone, pituitary, and ovaries triangle balance. So we use acupuncture help is to strengthen and tonify the kidney and also build up the kidney essence that will regulate this triangle balance between these three factors that will help stimulate your ovaries functional activity improve and then to help produce better quality of eggs and of course the egg quantity too. So yeah, I know a lot of people have the problem like low egg reserve, and we use acupuncture has been helping improve that part to help the egg quality and also the egg quantity. And another organ is the spleen, which is the organ or system in acupuncture theory to dominate our digestive system's health. It digestion, nutrition, absorption. And after that, we say spleen has a function to produce qi and blood, which is bioflow energy. And from bioflow energy, we call that qi. And blood is the nutrition supporting to our reproductive system. So with the sufficient plenty of qi and blood production, that will give more nutrition supporting to our uterus and ovaries, so that can bring more blood flow, especially to our ovaries and also the uterus, and to help our uterus part. That's the one we say can give more nutrition supporting to help our endometrial lining, the lining size, lining layers, and also the receptors, and then to help the implantation going well. So that's the spleen can help. So we through the way to tonify and strengthen the spleen, and then related meridians that can stimulate this part to build up all more qi and blood production. And another organ is the liver. That's the organ system. It has close relationship with our nerve system, which is liver meridian related. That's in acupuncture theory, we say this is stress or anxiety. Those kind of factors can be a kind of barrier to prevent people getting pregnant or to big barrier to affect our fertility treatment success rate. So we use acupuncture to help is to soothe the liver qi, which is the meridians starting from our toes and coming up and along to circle our liver and coming across our breasts and connect with our nerve system. So we use this way, we use acupuncture. This is natural way to stimulate the liver meridian qi moving that will stimulate your nerve system to help your brain release natural chemical stuff like endorphin, serotonin, those kind of things. So that will help your body natural way, physically and mentally stress reduction. In here, we see the physically, the organs stress reduction is more important. Yeah, just like to relax our ovaries can function better. So because the stress level rising can cause our internal organs contraction, the ovaries contraction or the uterus contraction. So uterus contraction that happens a lot during the transfer step. So that will directly affect our success rate of the implantation. So when this stress level reduce from the uterus, that will really help increase the success rate of transfer step. So yeah, that's basically what we work on.
So I guess these meridians are almost kind of imaginary lines that connect parts to different organs, right?
Yes,
Yeah.
yes,
So
exactly.
like your foot has a meridian, a line that almost connects to your liver, your spleen, or your kidneys. And by stimulating the more peripheral points, it may somehow stimulate those organs and help fertility then, right?
Yes.
Okay.
Yes.
Gotcha. Yeah. And then I was curious, so whenever you have a fertility patient come in, because I know you can use acupuncture for many different conditions, but let's say a patient comes in, they say, I'm trying to get pregnant. Does every fertility patient have sort of the same regimen, like the same number of needles, the same points? Or does it really depend on what type of treatment they're doing or specifically what fertility problem they have? Is it kind of more customized for each patient, or is it really all fertility patients get the same points?
It's a kind of customized. Every patient is different,
Mhm.
even though they have the same issue, like it called fertility,
Mhm.
but it can be we call that syndrome, different
Mhm.
syndrome. It could be we say liver chi stagnation is the main thing, or the internal organs deficiency like spleen deficiency
Mhm.
or kidney deficiency as main syndrome.
Mhm.
So based on the diagnose,
Mhm. Mhm.
with acupuncture theory.
Mhm.
So we'll use different meridians, different points to help to
Yeah.
target.
Because
Yeah.
I do think when I kind of think back to patients that have tried acupuncture, it seems like if me as the doctor can give them feedback as to issues that I'm having difficulty managing with them, then they can share that with the acupuncture specialist to target those issues. So let's say I have a patient where she has really thin lining and I'm doing everything I can to thicken it, but it's not working. Then maybe there's certain things you can try for that. Or if I have a patient who has low egg counts or something like that,
Right.
then you can kind of target that. Does that?
Exactly.
Yeah, okay.
Yeah. So based on thin lining, or for example, if it's the thin lining, it based can be caused by any reason. And as a doctor, you give them like estrogen.
Yeah.
You give them different medication.
Mm-hmm.
We use acupuncture. We need to target the yin deficiency.
Mm-hmm.
So the yin deficiency tonify the yin yang balance, which is the basic balance in the body. So yin deficiency, we target the yin deficiency, and then to bring up the lining growing. And if the patient we diagnose as yang deficiency, we need to target the yang to tonify the yang, and then to help more balance the yin yang. So these two are important, even though they are all related to kidney, spleen, liver. Still, has like yin or yang deficiency difference. So based on this difference, we use different needles, points, or herbs to help. And also recently we use biofeedback treatment that's been working very successfully to help. Yeah, we also combine using with Moxabustion.
Okay.
To help different kinds of like yang
Can you
deficiency.
explain what the biofeedback is with the are you talking about the electrostimulation?
Right,
Yeah, can you
right.
explain
It's a
to our listeners? Yeah.
magnetic electrical stimulation, so that attach to different area of the body for lining, for thin lining patients, attached to different area, or for low egg reserve patients that will attach to different area, and then we use this special magnetic electrical stimulation to stimulate, which has been having good results. Yeah.
Amazing. Okay, yeah.
I have to say that Dr. Yin did this for me, or I guess your partner did this for me, and I kind of felt like a racehorse. You know how racehorses, they do this when they're trying to heal their injuries. They put like the electromagnetic stimulation onto their injuries, and I was all hooked up, and I'm like, God, I need to take a picture of myself right now. I'm like training for the races.
Have you tried the Moxabustion too? Is that how you say it? Moxabustion?
Moxabustion.
I don't think so. Tell us more about that.
Right. The Moxabustion we use a lot to target different points and different meridians too. But main thing is to help people with yang deficiency patients. For the yang deficiency patients, they're easy to present this thin lining. So we give them instructions to help them understand how to do this. We normally give this as a homework. So
Homework.
they do homework.
Acupuncture homework.
Yeah, it's
Moxabustion homework.
Right,
I guess.
Moxabustion. It's a kind of
Yeah.
single herb. It's a single herbal stick. It helps the blood flowing, but it's a special. Besides the helping the blood flowing function, it has warm function in this specific points, and we use a special Moxa box. Put this Moxa sticks in, and then to give patients treatment. Yeah. Okay. So for yang deficient patients, we use this a lot.
Okay, gotcha. Now, for the average patient, I would say probably the most common patient I would see that's doing acupuncture is maybe somebody who's going to be doing a frozen embryo transfer. And I will say, too, from a scientific point of view, there are studies that have supported this that show that acupuncture can be helpful if the patient finds it relaxing. I will say sometimes I've seen a little bit of negative data on acupuncture if the patient finds it stressful. Like for some people, maybe they really feel like they don't have the time to go to the appointments, or the cost is stressing them out, or maybe the needle phobia or something, or a combination of those factors to where it's creating so much stress hormone to do the acupuncture that it may work against them. But for the most people who I think find it relaxing, it has been shown to be helpful. So I just wanted to get a sense for how much commitment that is for a patient. Like how many appointments would they typically need to do for a frozen embryo transfer cycle? Like on our side of things, and my average patient would have a baseline sonogram, a lining check, and then their embryo transfer. So they would have 3 appointments with you. How many appointments would they typically have for you during that time period?
Yeah, basically it will depends on the IVF transfer schedule. And if they have three or more weeks, so we will say we will do 2 treatments a week until 2 weeks before the transfer time. Those 2 weeks we will add 1 more treatment each week. When they're getting close to the transfer time. And the transfer day is a special day. Before and after transfer, one treatment before and one after transfer, 1 treatment after. So that's the
and then
basically.
What about once they do their transfer? Do they have any more after that? I mean, I know the one right after, but like in the subsequent days or weeks
during the
after
10
that?
days, during the 10 days waiting for the pregnancy test, we will do 3 different treatments to help the implantation.
Great.
So that's we've seen very good results from this kind of frequency. In China, we'd say we do more.
Really? More
frequently in China, but here it's hard to do more. People are busier, and also
it's true. We got a lot of working women patients.
And then they commute and different kinds of traveling or something. It's more harder to do. But I know a lot of patients, they are trying to say, oh, I want to do only once a week, or once every other week, or once a month or something. It's hard to say it has the same good results. Right. So
but would you say that
because acupuncture
one is better than none, you think, or no? So like, let's say ideally maybe they should do 3, but if they can't do 3, do you still think 1 would be better than none, or what do you think?
I think normally I want to say 99% of our patients, they listen to our treatment plan.
Gotcha.
They listen to our
That's
treatment
Well,
plan.
that's good. We
I
get
know.
some lessons.
Because acupuncture is accumulated treatment. In fact, it takes this process to reach the point, right? Just like, for example, if we give a patient a pain management, you can see the difference. Normally, it's hard to see immediately relief from the first treatment or the first few treatments, and after a few treatments, they say, "Oh, it's so different. It's so much better," or something. So it needs this process to accumulate it. So, but for the fertility
I'm glad
patients,
you brought that up too, because I was going to ask you what are other conditions besides just fertility that acupuncture can be helpful for. So it sounds like pain management.
Pain management. We call that natural pain management. Is a big category.
That's great.
To help people all different kinds of pain relief. From migraine or other painless spinal disorders, cervical disorder. So all different kinds of arthritis causing the pain, injury causing the pain. It is a good treatment to help the pain relief.
Yes. And okay, I was curious, do you ever, because you're a specialist, do acupuncture on yourself? Can you do that? Are you allowed to do that?
Course.
Can you reach your points that you need to get? Like
I always do acupuncture myself.
You do? Every day, or how often?
I do at least 3 or 4 times a day.
Really?
3 or 4 times a week. To help my sleep. Because I cannot sleep well, and I do acupuncture myself.
That's great.
and also I wear a needle to go to sleep.
Do you? Oh my goodness.
to
Now
help
that
my
sounds
sleep.
like a hazard.
Right. And also, I can reach my back. I can do my back.
You can
myself.
do your own points on your back?
Yes, I can do that. Because
Are there any points you can't reach?
Maybe middle back.
Okay,
It's
middle
hard
back.
to, yeah,
okay.
middle back on neck
Yeah.
or lower back. I
Yeah.
can reach.
You
my,
can do it.
Yeah, I do.
Love
myself.
it. Self-sufficient
Impressive.
woman. I love
Right,
it.
right.
Yeah.
Yeah, because I'm so familiar with that, and when I touch that, I know where they are.
Yes.
I know where the points are.
Yeah. Love that.
So, are there any side effects that our patients should know about or expect if they're planning on doing acupuncture?
Acupuncture doesn't have any side effects. The only thing occasionally patients can find some bruises, a little bit bruises on the abdominal area, or abdominal area is the most common, especially they're on blood thinner or doing the other injections occasionally, but not very much. Just like I want to say, like 1% or 2% patients. It depends on their body quality, I think.
I was going to ask about pregnancy too. So we are really excited because we actually just got laser acupuncture here in the clinic, and we were doing the training for it. And they did tell us there are certain points you really should avoid doing on somebody if they're pregnant.
Oh, yeah.
And so I think that comes from the actual acupuncture data. So it sounds like if a patient's in the window where they could be pregnant, they definitely need to let you know, right? So that you can avoid certain points. But can you tell us why you would need to avoid certain points?
Yeah, those points, once patients get pregnant, we see some points we have to stop doing treatment on them. Even though we've been doing that during the process there to help them getting pregnant. So those points, such as we stop all the points on the abdominal area, and also we need to stop some points on the hands and also the feet and also the legs.
Okay.
Yeah, some points, but we only choose some safe points to trying to support, to send more nutrition supporting to the uterus, to the basically kidney meridian, and also the spleen meridian.
Yeah.
And at the same time, we say to reduce the stress is always the forever topic. We can still do that.
Yes. Well, because people may be wondering, well, if you're pregnant, why are you even still doing acupuncture? But acupuncture has been shown to be helpful for other things like nausea. And certainly we know when you're pregnant, you can feel lots of nausea. So it is kind of nice to have a natural treatment that you could consider for that as well. Because, a lot of my patients, once they're pregnant, they really want to know, for anything, is there any risk to taking this medication, right? And
Right.
I think acupuncture could be a really helpful option for patients who want to try something a little bit more natural.
For nausea,
vomiting.
Right, nausea we do a lot. We do a lot to help people's nausea, and also to watch the blood pressure and also the blood sugar.
Okay.
Yeah, we have some referrals from internal or OB doctors. Their patients got blood pressure during the second trimester. They cannot take medication, so we use acupuncture to help them control the blood pressure to the good level.
Well, and I think that makes a lot of sense, because sometimes if somebody's really stressed out and worked up, like their blood pressure is high, but if they're feeling relaxed, I can see their blood pressure comes down and they feel better. So
Yeah.
Yeah, well, amazing. Okay, well, should we wrap it up for the week then?
Thank you so much. We really appreciate you coming. And so
thank you for having me here.
Yes, thank you so much. I learned so much, and one of these days I'm going to have to go come get some acupuncture too. I've got lots of problems, not fertility problems, but I'm past those things. I'm too old for that, but I've got lots of other things that I'm sure you can help me with. So I'll have to try it out. All right. Well, thank you guys. If you have any questions for Dr. Yin or for us, leave us a comment and we can follow up on that. We'd probably love to have you back at a future time too.
Sure.
All right. Well, thank you guys. And then if you would be so kind to consider leaving us a positive review on either our podcast site or on YouTube or on our practice website, we would greatly appreciate the help with that. And I hope you have a great day. Bye.
Bye.
Bye-bye.